Good evening, Hare Krishna, dear devotees. Welcome to the Advanced Care Planning, Living Wills, and Healthcare Surrogate Seminar. This is brought to you by the End of Life Care, Alachua. I'm Madhurya Lily Devidasi. Thank you for taking time out of your busy schedule today to attend this very important and necessary part of planning that is really should ideally be done for everyone, regardless of whatever their age is. Tonight we have a special guest, Mr. John Jordan, who has been with Haven for several years. He's part of Haven's community outreach department, and his expertise lies in advanced care planning and the transitions program. He will do a presentation, and then we'll take questions you have in this regard. For those listening on Facebook and YouTube, you can type your questions in the comments at any time. If anyone would like one-on-one help with Mr. John to fill in your forms, he would be happy to meet with you. It's a complimentary service offered by Haven. I have also included an addendum for devotees to make their spiritual wishes known. So that can be kept with the living will as a complete document. And if you need help completing these forms, then there is a link below, a Google Docs form link found in the description of this presentation. And the link is live now, and you can fill that in, and I will get that information and forward it to Mr. John. Please keep yourself muted during the presentation, and when you need to ask a question at the end, you can unmute yourself. So thank you, Mr. John, for coming today and joining us. Please enlighten us on advanced care planning.
Thank you for having me. I appreciate the opportunity to help people learn a little bit more about advanced care planning and setting their goals and wishes down on paper and doing their advanced directives. So any way I can help, any questions, I'm going to try to do a nice presentation. And at the end, please save your questions. And at the end, I'll try to answer everything you have. Okay. Again, as Lily said, I'm John Jordan. I'm with Haven's Community Resources. I have been here for 2.5 years. I help administer the advanced care planning programs and the transitions program, which I'll speak a little bit about at the end. And I'd love to just give you a little bit of information tonight, see how we can help. So let's get right into it. I'm going to put up a slideshow, and I'm going to go through some slides, and I'm going to talk about advanced care planning. So let's do this. All right. Now, can everybody see that?
Yes.
Yes.
All right. So again, I'm with Haven Hospice, and this is advanced care planning. So planning ahead. So when we think about advanced care planning, we want to plan ahead. Most people make plans for important life events and situations, for births, for marriages, for birthdays, and different things. Planning for healthcare needs and discussing wishing is often avoided. It's a taboo subject. Important and essential to ensure the treatment is received is consistent with goals and preferences. And that process is called advanced care planning. Why is ACP important? The reality is only 24% of people consider themselves very prepared to deal with end-of-life issues and difficult medical decisions. 50 to 70% of older adults facing treatment decisions are incapable of making those decisions for themselves at a time when these illnesses come upon them. In the last month of life, half of all Medicare patients visit an ER, and a third are admitted to the ICU. Only 1/3 of adults have completed an advanced directive. Why is advanced care planning important to you? because it helps you to empower your wishes and your goals of care to be known and followed when you are unable to speak for yourself any longer. And planning ahead helps to diminish the anxiety of death through engaging in preparation for end-of-life circumstances. And one great thing it does, and it removes a painful burden of decision-making from your loved ones. There's a trauma involved. There could be trauma involved for your family if they have to make these decisions and they don't know what you wanted. And it can cause them lasting pain. So advanced care planning is a wonderful gift that we can give ourselves and we can give our loved ones. So some of the differences between advanced care planning and advanced directives. Advanced care planning, as well as advanced directives, should be an ongoing process. But a lot of times, advanced directive, when people do their advanced directives, it's a one-time task because they forget about it. They do them and they forget about them. It should always be an ongoing task because we change our medical situations, our life situations, and our thought processes change and are fluid throughout the time of our lives. So advanced care planning and your advanced directive should always be fluid. They should change as you change and always reflect your wishes. Advanced care planning can be reviewed and updated, should be integrated into routine patient-centered care, and that's for both. Specific and comprehensive. So advanced care planning deals with the whys. Why do we choose to make these decisions and do these things in our end of life situations? And it focuses on the plans that we would like to see followed through. Your advanced directives, like I said, should be reviewed and updated as needed. But most of the time they are unavailable to physicians. We try to change that by making sure that when we do advanced care planning, that we make sure that your primary care and the people that are important to you receive these documents. Advanced directives are broad and sometimes difficult to interpret. They're broad in the sense that they cover a wide range of a broad medical condition. They can be difficult to interpret because of the language. And advanced directives deal with what, and they focus on procedures, not the plans. Advanced care planning should be a good complement always to your advanced directives. So, advanced care planning steps. We want to share your personal values and beliefs, and we want to share that with your loved ones. Explore what you may or may not want in certain medical situations. Those are your living wills, and we're going to get a little bit more into that in a minute. Choose someone to communicate your wishes. If you are unable, that's your healthcare surrogate. We're going to talk about that also. Write down your wishes and share your plan. And reassess your preferences and update your plan periodically. Like I said before, our life situations are fluid and they change. And that's why you should always review and update. So here's what the components of an ACP session are. It's a guided conversation with your healthcare surrogate and a trained facilitator. So we sit down and we help you assess and understand your disease and your symptoms and its possible complications, and discuss your disease trajectory. The reason for this is we want to help you to understand that what is going on, and then if you have questions, help you to pin them so that you can present them to your medical professionals and get the answers that you need to have peace of mind. And also that your loved ones know exactly and understand what your situations are. Part of the ACP session is to review the purpose of an ACP and the role of the healthcare surrogate. And review, if you have existing documents, we review those existing documents. And we can help you update them, and we can discuss them with your family, and we can discuss them with you, and make sure that your loved ones understand what you want. So once an ACP session is done, we try to follow up. We always do follow up. We, like I said, we try to help you pin questions for your physician, questions that you need answered so that you understand and are informed to make good decisions. We help put you in touch with the resources if you need it, and help you arrange for services that you may need later. If there's additional ACP discussions that need to be done, we help you facilitate those. And then we help you complete and distribute your written advanced care plans and your advanced directives to the proper and appropriate people. So, what are advanced directives? It's a general term that describes two kinds of legal documents: living wills and medical powers of attorney. This allows a person to give instructions about future medical care. Future medical care, should he or she be unable to participate in medical decisions due to serious illness or incapacity. And for the people that are listening, everything that I've put here on the PowerPoint are Florida statutes. Chapter 765 provides all the information you need on end of life issues for the state of Florida. But you should always check, if you're in a different state, check and see how your state regulates the advanced directives, and so that you clearly understand what's going on. So, a healthcare surrogate. It's also called a healthcare proxy or a medical durable power of attorney. It's the person named in your advanced directive that under state law to make healthcare decisions on your behalf when a person is no longer able to make decisions. So that authority does not take effect until an individual lacks the capacity to make decisions. That's right there on the form. But unless otherwise specified, you can specify that your healthcare surrogate can do things like gather records for you, that you can give them power and authority prior to you having not being able to make these decisions. There's a place for that, but most people don't choose that. Most people choose to retain that power and that control until they lack that capacity to do it for themselves. And a healthcare surrogate, and this is very important, it should be someone who is trusted and be able to respect and follow your wishes. I'll give you a little example about this. This is, I've got an individual who named their grandson their healthcare surrogate over her 3 children. And there was a reason for that, because when I counseled her, I wanted her to understand that it should be someone who would not make decisions emotionally and that would follow and respect your wishes. Not everybody has that option, but this individual did. And she chose her grandson because she knew that he would respect and follow her wishes. She knew that given that burden of those choices to her children, that they would have difficulty with it. So it should always be someone who is able to respect and follow your wishes. So what if I don't have a healthcare surrogate? In the state of Florida, a professional healthcare proxy will be appointed to you after the next of kin have been exhausted. And in order of importance, in the state of Florida, your spouse is the first person. If you don't have a healthcare surrogate, the decision-making abilities fall to your spouse. Secondly, your children. Third will be your parents. Fourth will be your siblings, then your grandparents, uncles and aunts, and kin of your last deceased spouse. Now go back to the siblings and the children. If there's a majority rule in the state of Florida, they have to if you had 3 children and they could reasonably contact all 3, 2 of the 3 would have to agree upon what decisions to be made. And the same with the siblings. And that they will make a reasonable attempt to contact these people, your children, and get them to agree upon a course of action if you don't have a healthcare surrogate. Now, that can fracture relationships and families. I've seen it. That's why, as I said before, designating a healthcare surrogate, doing your advanced directives and advanced care planning, it's a gift that you can give your family as well as yourself. So, living wills. A living will is a legal binding document which an individual documents their wishes about their medical treatments at the end of life when they can no longer communicate. A living will does not provide for any financial planning of estate or assets. That question gets asked a lot. What it does do is it protects your legal right to refuse or consent treatment prior to the end of life. That you can refuse or consent. But it's not just refusal of treatment, it's also consent to continue treatment if you choose so. So it does not take effect until disease process is not reversible and an individual is at either end stage, terminal, or in a permanent vegetative state. So that means when the doctors believe that your disease process is no longer reversible, there's no cure, there's no maintenance that can be done, only then will a living will take effect. And that is on the guidance of a medical professional. And also, as well as the healthcare surrogate forms and the living wills, they do not need to be notarized to be legally binding. They only need to be signed and witnessed by 2 impartial parties. Those parties should not be anyone who is your next of kin, direct relation, or someone who has a stake in any of your financial or medical decisions. They just 2 impartial parties, and that becomes a legal binding document. So additions to the living will, I did a little research and I got a very nice attorney, Mr. Walker Bullock, out of Bullock Law in Williston, that sat down and gave me a little bit of his time. And when talking with him, most living will forms have a place for additional instructions, and most can be addended and things added to when it comes to conditions such as refusal of medical procedures and products, blood products, dialysis, different things like that. But if you have any questions or need any clarification or help with adding these, please consult an attorney for assistance. Now, care plan. The criteria is you must be 18 years of age or older. You have to agree to participate in the ACP, and you must have the decision-making capacity. It would not be ethical to have people sign legal documents that do not have the capacity to make decisions. And state law says under the age of 18, you are still bound to your parents. So what if you already have advanced directives in place? You should review and update your plans and following the 5 Ds every decade, the death of a loved one, divorce, and that one's important, diagnosis or decline. I say divorce because a lot of times people do not, because they don't review their documents like they should, they will have their ex-spouse as their healthcare surrogate when it comes to decision making. And that's never an ideal situation. So if you want to start planning, like Lily said, I'm available. I am a certified ACP facilitator. Haven does these free of charge. It's a service to the community, and we can help with your advanced care planning and help you with your advanced directives. Now I'm going to go back to this one. I'm going to leave this screen up. Lily had asked that I talk a little bit about do not resuscitate orders. The do not order in the state of Florida is a document that you get, and it's not something that you would want to have filled out unless you were in some terminal condition or end of life process. It's not for healthy people, but you can consult your doctor. In fact, you have to consult your primary care doctor or your physician, because do not resuscitate orders can only be signed by your doctor. And a do not resuscitate order is an order that says that if that time comes that you don't want anything done, you just want to die a natural death. And that's a conversation to have with your doctor. And if he feels and you feel it's an appropriate thing to have, DNR is by state law has to be on a yellow form. It has to be visible, because if EMS was called, and EMS still should, in the event that if you were in this situation and you were dying, that EMS should be called, because it's good for them to come, because they can help keep you comfortable and process and support with your family and those in their life situations. And that's something that in the sessions I talk a little bit more about, and about CPR and about what CPR really is. CPR can be a life-saving treatment, and it can also be dangerous to you, as something that I talk about more in the ACP sessions. But I'd like to come now to, at the end of the program, talk about some of the programs that we provide through community resources. We've already talked about the advanced care planning. It's what we've been discussing. One of our free outreach programs that we do for the community is our bereavement support. We help provide grief counseling and grief support to people in our community. You don't have to be, your loved one didn't have to be with Haven Hospice. We do community support. And lastly is our transitions program. It's something that I'm very, very proud of. We provide support to people with advanced and chronic illness out in our service area, in our communities. What it is it's volunteer driven. Our volunteers make routine calls. We check in on our clients and their families. We see how they are. We provide support. We help answer questions, difficult questions if they come up, and we help provide resources out in the communities. So if you're in need of any kind of resources, transportation, food, meal, like from Meals on Wheels, help with your utility bills or things like that, our transition support help provide social support to you out in the community. Now, again, I may have been a little rushed through the program, but here is my contact information. This is my office number, and this is our email on how to get in touch with us. if you have any further questions, or you'd like to schedule a session with me, or you would like to talk any more about the services we provide, please feel free to reach out here to either of these numbers. I'll leave these up for a minute. And if I could, I'd like to hand this back over to Lily. I believe she has some things she wanted to add, and then we'll take questions.
Well, thank you, John. Thank you very much. That was a very good, informative presentation. The only thing I wanted to add was regarding financial wills, because that often comes up as well. And Haven does not do financial wills, as you mentioned. However, there is a resource that our temple president, Mother Mukia, has been dealing with. Her name is Nadine David. She's in Gainesville. She has offered to do living power of attorneys and, anything like anything that deals with financial wills and assets. For a fee, that'll be for a fee. So it depends on what your requirements are. It'll be based on that. So the link is in the description below. All her information is there. And there's another resource that Mr. John was telling me about. It's called Three Rivers Legal Services. And they provide every kind of estate planning and any other kind of legal aid that you need. And it's on a fee, sliding scale fee, right? Is that right, Mr. John?
They provide a lot of pro bono work for people who do not have income, but they also, I think, on a fee basis, that if you can't afford a little bit more, they pay. They charge. If not, a lot of their services are free.
Okay, so
And they're
amazing.
located in most of the communities through North Central Florida. Also, they're in Jacksonville, Gainesville, most all the counties.
Yes, and I was told by Mr. Singh, Ajay Singh, a lot of the community members in the ISKCON Hare Krishna Temple know about him. He's a lawyer. He's a corporate estate planner. And we were discussing this, and he was saying that if you have a simple situation and you name beneficiaries for everything that you have, like bank accounts, any investments that you have, car, house, even, if you have very detailed beneficiaries listed, then if you have a simple situation, many times you can avoid probate, which costs a lot of money. So because when a person dies, then it has to go to the state and they go through probate, and it can be very expensive and cause a lot of delays. So if you have bank accounts, safety deposit boxes, anything that you have legal, if you have a beneficiary listed, that can avoid a lot of problems later on and avoid the high cost of probate. So he agreed with that, and he said that's one good way to around wills, which can be very expensive, but maybe necessary for some people to have those kinds of assets. What do you think, Mr. John?
One thing I would add to that is, if you can put a medical power of attorney and medical decision making within a will, within your last will, and within your financial estate planning, they can go together. Now they're separate documents, like there's your last will, which is your estate, and then your medical power of attorney, but they can put medical stipulations within all your financial planning so that it's one document. So that's why, if you have something, an extensive assets in a state, you can go through a lawyer, find an attorney that can help you couple all these together into one document.
Good idea. Yeah, that's a good idea. Otherwise, just make sure you have beneficiaries for everything. Even your bank account, you may have $500 in it, but if you don't have a beneficiary, it's going to be a problem. Nobody's going to be able to access that account unless it goes through probate, etc. So makes it a little easier. So does anybody have any questions that they would like to ask?
None?
Well, I can ask you one question. The signature that you were talking about, that you need two signatures, two witnesses for the living will, correct?
Yes.
To make it legal. But do those witnesses need to know the contents of your will?
No. They're not witnessing the contents. They're witnessing your signature, that you sign that document. That's all. They don't need to know it. They don't need to have a copy. And they're not legally bound to anything when they sign it, other than they said that they witnessed you sign that document, and that made it legal. So no, they don't need to know the contents.
But how do they know that what is in the document was not forced upon the patient who's doing it?
They don't. That's a well, that's why if you had somebody do it like myself or a facilitator, or you had a lawyer do it, then you know how it's being done. If you do this on your own, that's what it is.
So it's an important part of the piece that you have it done properly from a professional then.
Yes, it's helpful. How people can do these on their own. You can download these forms. These forms are free all over the internet, and you can do them yourself. You don't need somebody, but having someone help you and walk you through the lingo and the different and the verbiage of the living will, because that can be tricky. It's helpful.
And then you said that Haven will keep a copy of the advanced care planning directives. And then if you're in the hospital or at a doctor's office, they need that, you can transfer that over to them. Is that right?
Yes. That's important. When I do an ACP session, I kind of create a chart for people and I save their forms. That way you can always come back to us to review and update. If you need these documents sent to somebody, we can send them. And that way you always have a copy on file somewhere to reference back to.
And you did mention that when you have big life events, that's a good time to change your living will or your healthcare surrogates. Other than that, how often should you look at it?
Well, if you're not having any major life events, a decade, every 10 years. And people feel that you have to wait till you get older to do these documents. You don't have to. I can tell you from experience myself. I was a young man in the Army. I wrote my first will when I was 19 and I was being shipped to Iraq. So accidents happen, things happen. Preparing ahead, especially if you have a wife and kids, you're young, you have a spouse, you have children, and putting that on paper so that they don't have to worry about what happens, and then reviewing it. Like I said, life is fluid. We change. We change with age. Our ideals change as we get older, as we mature. Our health conditions change. All of our circumstances change. So staying on top of these every so many years, if you're a healthy person, every 10 years, it is a good rule of thumb. If not, if you any diagnosis, death of a loved one, and that divorce is important, and sometimes separation too, not just divorce. I've been witness to people that have been separated for 20 or 30 years and never got divorced, and their spouses lived on the other end of the country, one in California, one in Florida, and the wife, the estranged spouse, had to be called to be the healthcare surrogate and make the decisions for the husband that she hadn't seen in about 25 years. So reviewing these documents at important life events is very important.
Good advice. And also for our community, a lot of the members have specific desires of how they want the environment when they're passing away from this world, transitioning. So I have given, or I'm going to give Mr. John a one-page document that he referred to earlier. You could add as an addendum to the living will. And it was actually formulated by Vaishnava's Care by Sangeeta up in North Carolina. So it's well researched. So if you can put your wishes down, you know, very detailed wishes, what you want at the end, and who you want to be there, and what you want people to do, etc. So people will know exactly what you want and not have to guess. You know, which people do you want there? Which people do you not want there? What do you want done? You know, what kind of, do you want some books to be read? Do you want some music? Who should be singing? You can make it as detailed as you like, and that'll make it much easier for your caregivers, your loved ones, to make those things happen for you. So I will give that, and that can be added to the living will as a addendum and kept together as a document, complete document. So.
Okay, Valentina has a question.
Yes, how do you get people to actually fill out these legal forms? Most of the older people, I try to talk to them about it, and they say, oh, if they stop breathing, I should not call 911.
Well, they need to just be educated on the conditions if you don't have these documents, because you can't legally, if you were there and a person is in distress and they have not either set their wishes down on paper or they don't have that DNR, you are legally bound to call 911. I mean,
yeah,
you have to. And so education helps people make better decisions. And if they want to, I can talk with them, and I can tell them what, you know, or you can talk with them, their loved ones or spouses, people that they trust, and let them know that there's certain things that have to be done if planning is not in place. There are certain things that they will not be able to avoid. And if they do have specific wishes, that they have to be written down. Because if not, legally you're bound. Anyone that would come in contact would be bound to try to save their lives.
Yes. Thank you.
Yes, and that could mean chest compressions, you know, CPR, and it could mean breaking ribs, and it could mean being intubated, and,
that's
many,
why
many other things.
I didn't discuss CPR, because CPR can be a little bit gruesome when you actually talk about, especially CPR can be damaging on a young person or a healthy person. CPR for someone who has a terminal illness or has these, it can be devastating. It's painful. It's traumatic. And if they do survive it, and the percentage of survive in CPR are very low. In a hospital, in a clinical setting, is still only at 10%, 10, 11%.
Yes.
If EMS has to come to your home those percentages drop all the way back down to 3 or 4% of survival rate.
Mm-hmm.
And if you do survive, there are different situations, things that can happen from that, because you don't know how long the brain was without oxygen. There's hypoxia. And the brain does not recover, or doesn't recover fully. There's the broken bones. There's the trauma to the organs and the body. Those are things I discuss a little more in depth in the personal and the more intimate settings. And it's not to scare people, and so they know that what they see on TV is not the truth.
Mm-hmm.
You know, you get intubated with a tube down the throat, and then they use either manual chest compressions or they use electrical. And it can be, like I said, if you recover, a lot of times people, especially if they're in a frail condition to start with, they do not regain the same quality of life.
Right.
So educating people on that, the CPR issues, the DNR issues, the importance of advanced care planning, to set those goals and wishes down, so that if you do call 911, and you should still call 911 if they do have a DNR, that EMS comes and they just sit there and kindly support you, help keep you comfortable and out of pain, while you have a natural death.
Yes. Mm-hmm.
So what would happen? Go ahead.
No, go ahead. Are there any more questions?
I was going to say, let's say somebody, in their 20s, 30s, or whatever, doesn't have, somebody relatively young doesn't have a living will, and they're in an accident, and they become brain dead. So what is the obligation of what will happen in that situation?
Well, that falls back to, if they don't have a healthcare surrogate in place, it falls to that next of kin, that kinship. And that starts with spouse. If they're young and they have a spouse, it goes to their spouse. The next is their adult children. If they had adults, and if they're young like that, they're not going to have adult children. It's going to move straight to their parents. Their parents will be their decision makers. And then siblings, and down that line from that earlier slide, siblings, grandparents, and it can go all the way down. You can have a friend, if it's a trusted friend and it's someone that understands and can respect your wishes, your friend can be your healthcare surrogate. It happens every day.
Mm-hmm.
It just needs to be somebody that you trust, can respect your wishes, and they understand what your wishes are and your goals, and can follow that through for you.
Yeah.
That happens quite often, more than we would think, right? There's accidents at the springs, accidents on the road. It happens all the time. That one situation.
Not everything's about disease processes and things. Sometimes it's just straight, like you said, it's just trauma, something, horrific life event that happens. That's why we encourage everyone to do their advanced care planning, to think about it, to talk about it, to at least have, if at a young age, have a healthcare surrogate designated, and maybe have a living will. Because in that living will, like I said, it's a refusal or consent for treatment. Right. You can refuse all of that treatment, or you can say, well, I want these things to be done to me. And you make sure that that's on paper, so someone doesn't make the decision if you chose to go in that direction and they didn't know.
Yes.
Anything else?
Yes. What about I had a visitor, a family member, tell me that a patient had a DNR order, but it was not on a piece of yellow paper. It was on a computer somewhere. And I tried to tell her we needed to get the yellow paper, and she insisted, oh, it's on the computer. Anyway, the woman ended up having a stroke. I had to call 911. They had to do CPR, and then the daughter was very angry. Where is this information that people think that you can put it online and you don't need a paper?
It's, as Florida state law says, that a DNR, it's a form. It's a state form.
Mm-hmm.
It must be signed by your physician, by you,
Right.
or your representative, your physician, and it must be on a yellow paper, and it must be presentable.
Mm-hmm.
It must be in an area to where it can be seen, because if it's not seen, EMS is still going to do all the
Right.
life-saving measures. If they
Yes.
cannot put their hands on it, they will continue to do life-saving aggressive treatment.
Yeah.
So it has to be on that yellow form. Now you
Mm-hmm.
can document it in the different EMRs and the different systems, but you need to have that actual legal document, that
Right.
yellow paper from the Florida state
Yes.
saying that I do not wish to be resuscitated.
Mm-hmm.
They
Yeah.
won't even, EMS won't even transport you from hospital to home or wherever you're going if you are DNR and don't have that paper.
Mm-hmm. Yeah.
Because if something happens en route and you don't have that yellow paper, they have to do everything to save you.
Yeah.
Any other questions anybody has? So I have a comment here. It says, nice healthcare plan for the elderly. But as you mentioned, it's for not just the elderly, but even anybody over 18, really.
I mean, we all know somebody that's had
Yes.
a horrific, tragic event happen in their life.
Mhm.
It's best to be prepared for it.
Mm-hmm.
Anything else? Anybody? Any questions? Your chance.
Okay, in Florida, do you have to have a doctor's order if you're in the hospital that says do not resuscitate? My mother was a do not resuscitate, and they were going to do CPR on her because the doctor did not write an order.
So the order needs to be in their system. It's just like if an EMS came to your house, if they don't have that order, then it's as if it doesn't exist. They will have to continue aggressive treatment. So within their system, they would have to have that order. And in most hospitals, if you are a DNR and they don't have it, they will bring you another one.
Yeah, she
sign.
had it. Yeah. Anyway, they came to the door and I would not let them in. So, yeah.
Now, if they had the order, and
Yeah,
that's,
it's really
then
strange.
you know, a DNR can be rescinded at any time also,
Mhm.
but it has to be rescinded by the patient, or it has to be rescinded by the representative.
Mm-hmm.
So, and that's something that people should know about DNRs. People are afraid to do a DNR if they need one, because they're afraid that they're locked into something. That's the same thing with these living wills and these ACSs. They believe they're locked in once you do this. Like I've said before, these situations are always fluid in your life, and everything can be updated, reviewed, and changed
Yes.
as you wish.
Mm-hmm.
Can you clarify the terminology of medical, durable power of attorney, and healthcare surrogate? Can Can you just
Well,
clarify those terms?
they're interchangeable. They're the same person. Your medical power of attorney is your healthcare proxy, is your healthcare surrogate, is your healthcare agent. They're all interchangeable terms. You can have a medical power of attorney within, like I said, within estate planning. You can have a medical will inside a complete will, where your medical power of attorney is listed in that will also. Medical power of attorney is just another name for your healthcare surrogate.
So the basic three documents that everybody should be aware of are the living will, the healthcare surrogate, which has a few other names, and the last will and testament, correct?
The last will and testament is your estate planning for after you pass.
Right. So those are the three main documents most people should have in place.
Yes.
So medical power of attorney is different from power of attorney?
Yes. Yes. Your power of attorney is your financial planner. That's your estate executor. That's your estate agent. Your medical power of attorney is specific to your medical. Now they can be the same person, but your medical power of attorney is the person who makes your medical decisions for you when you become incapacitated.
There's another
Right.
a word for power attorney is executor of your will. Is that the same?
Yes. Power of attorney is usually your executor.
Or could they be different?
Well, you know, I don't want to get run down the financial and tell you things that I don't know about, because I don't mess with the financial stuff. So there's a whole lot of terminology there that I don't understand myself.
Mhm.
But I agree, you have to have a power attorney either for financial or for medical, and you can combine the two, like you said. Some people do that in their complete will. Okay, any other last questions before we conclude? We have a question that the person is asking, what does DNR mean? Well, we kind of covered that already. You can
Do not resuscitate
take
order.
Right. Okay. Okay. Well, thank you very much, Mr. John, for joining us today. You
I
you
thank you
really
for
helped.
having me.
You
Thank
really
you so
helped.
much.
You've really helped clarify what advanced care planning is and how important it is for everyone to seriously consider having that in place, because we know that life is very fragile and
Mhm.
illness and death can come at any time. So I
Yes.
will forward all these requests that I get on the for the one-to-one help for having you help them complete the documents, and I'll forward that to you once I get them on the Google Forms. So please fill in the Google Form document in the description if you would like that one-on-one help to complete these forms. It's been a pleasure, and we hope you can come back again, Mr. John, to enlighten us on other topics.
Thank you very much, everybody.
Yes.
I
Thank you. Thank you.
Thank
to
you.
be here.
Thank you. Thank
Y'all
you
have a
to
good night.
our
Yeah, you
thank
too.
you to our thank you to our tech, Maishnavi Dasi, as well. And
Yeah.
have a good evening, and take care, everybody. Hare Krishna.
Haribol.
Hare Krishna.
Hare Krishna.